This is I forget the story of the patient, but it was an MR, and I'll just go straight to the finding. You can see that in this patient, the gallbladder has a very peculiar appearance on T2. You can see very kind of asymmetric thickening of the gallbladder wall. There's also what looks like edema of the gallbladder. Here it is on the pre-contrast T1. And then as we give contrast, this area, hold on a second, sorry. It kind of demonstrates ill-defined enhancement, very strange appearance. You know, it seems like it spares the mucosa. It doesn't really look like your typical cancer, but you know, clearly very not a normal structure. And if we look at diffusion, you can see that there's signal there. Remember, it was very dark on T2, and now this area demonstrates quite a bit of restricted diffusion. So, and the appearance was less mass-like, but more infiltrative. And you can see on delay images, there's just diffuse kind of enhancement. So again, very infiltrative almost rather than mass-like. Not a very common appearance for gallbladder cancer, especially given the delayed enhancement. But that was one of the things that we proposed in differential. We also thought maybe something unusual, such as lymphomatous infiltration, which can kind of be like this. Artie, do you have any suggestions to my differential?
Well, since you're showing it here, I was thinking of IgG4 and xanthogranulomatous cholecystitis. Xanthogranulomatous cholecystitis usually has cystic spaces, but I guess if you're talking about a diffusely infiltrative, inflammatory-looking process. Right.
So this is exactly what it was. Hold on, let me just get the thing. So this was exactly that. It was you know, they took it out because there's no way we could predict the past, but it was xanthogranulomatous cholecystitis. It's a rare chronic cholecystitis. Couple of cases that I had before this one were much more aggressive looking and really looked like very mimicked the appearance of xanthogranulomatous pyelonephritis, where it was just ugly, inflammatory, infiltrative, much uglier than what this one was. So generally, we see intramural accumulation. The underlying cause is this intramural accumulation of lipid-laden macrophages, and it's again chronic cholecystitis type. The cases that I've seen before this were much more, again, aggressive, you know, and usually often can be indistinguishable from aggressive cancers. And the hallmark is this marked gallbladder wall thickening with, and the lipid-laden macrophages kind of mimic necrosis or cystic components, especially on CT. But this was it. This was like a unusual appearance of xanthogranulomatous cholecystitis.
Awesome. Yeah, I think it's it would look really unusual for gallbladder cancer because the mucosa looks intact.
Right. Right. So we was basically read it as like unusual something, but the main thought was maybe some sort of infiltrative lymphoma leukemia. All right. So this last, yeah, go ahead.
No, they just said, great cases, ma'am. Thank you.